The possibility that funds from the Public Investment Corporation could be used to fund the national health insurance is now floating around. There is a strong possibility that this could be realized, especially given that the NHI, to be funded, needs so much in terms of just pure resources, in terms of spending. So it's little surprise that this is on the table, but to help us understand and unpack the implications, we're joined in this particular discussion by Marius Roodt from the Institute of Race Relations. Marius, thanks once again for your time and being with us here at the CRA. Just to start off with the announcement, I believe, made by Minister of Health, Dr. Aaron Motsoaledi, in a question that he answered in Parliament. So, I guess this doesn't come as any surprise that government might in some ways, or at least the Department of Health, might be trying to put pressure on the PIC.
Yeah, I think that's exactly what it is. But also it just shows that the government has absolutely no idea where money from NHI is going to be coming from. I mean, the biggest question around NHI is the funding. And every time the government's been asked about it, they've been engaging in, magical thinking, saying it's going to come from somewhere, or they've just thrown their hands in the air. And I mean, even statements from people like Nicholas Crisp, when they talk about, these assets that are in the hands of the private sector or whatever, talking about money that's funds from medical aids at the saving accounts of medical aid members. There's this weird seeming belief that this money somehow belongs to the government. But people also need to remember that people pay for their medical aid as part of their after-tax income. They've already been taxed on their income that's going to medical aids. That money that is in the coffers of medical aids, people's money that they pay every month in their premiums and what have you, that money does not belong to the government. People who are paying their medical aid premiums have already paid over what they legally obligated to the government. It's absolutely crazy that the government talks about that there's also all these these funds in private hands. The government has they have no right to those funds, and it's just shows the very strange thinking around NHI in South Africa at the moment.
Marius, on the Public Investment Corporation specifically, I mean, the word public is in the name. So perhaps the connotation or the image that is associated with it is, oh, this is public money. So, and as always, when one says the public, then, you assume the state or the government should be the administrator or the custodian or the manager thereof. But the trillions of rands in the PIC broadly, in that sort of pot, those are the savings of South Africans, of South African workers, of public sector workers, or correct me if I'm wrong.
Well, as far as I understand, it's basically all government employees' pension funds. Mm-hmm. So out of the PRC's assets, 90% is for the GEPF, Government Employees Pension Fund. The rest of it is then made up from the UIF and workmen's compensation and that kind of thing. And there's, little bits of money for other kind of small things, but 90% is for the government employees pension fund. Mm-hmm. And pension funds can invest in infrastructure. It's not a crazy thing. It happens around the world. And actually, pension funds actually like investing in infrastructure projects because they're quite solid projects. They're things that are going to last a while. But at the end of the day, you still have to get a return. You can't use them as a kind of a slush fund or just as another kind of tax base or whatever. There has to be a return for the pension people who've paid into their pensions at the end of the day. That's the reason you have a pension fund. It's not just a savings account. You need to get a return on it at the end of the day. And also one of the mandates of the PRC is that they do have to get returns on their investments. Of course, there is a bit of a social mandate. Part of it is, transformation and, social investment and all that kind of thing. But in the mandate of the PRC, they have to get a return over an investment horizon. And generally, depending on the project, is between 5 and 15 years. And the NHI doesn't fit into any of that kind of thing. NHI is obviously an indefinite kind of project, and it's not something that you could get a return from. Aaron Motsoaledi said, but PRC's invested in private healthcare and so on. That may be true, but private healthcare is also designed to get profits. People open private hospitals because they're going to get some kind of profit from it. Government hospital, you don't necessarily need to expect a profit. And I think that's fine. The government doesn't need to expect profits from all the kinds of things it builds and invests and so on. But the PRC and government employees, pensioners, they need to be able to get a profit or get some kind of return from their money. And as it stands, I mean, I don't think anybody expects you'll get a return from investing in the NHI or in a government hospital.
Marius, since 2012, South Africa's GDP growth per year has averaged 0.8%, so up until 2023. If we look at one of the things South Africa really needs to unlock, and this is maybe one of the top priorities for the GNU, is fixed investment, so investment in infrastructure or quote unquote enabling investment. So in things like that versus in just consumption, or in other words, in salaries. So that's not to say that every public sector employee doesn't earn their salary or wastes it, but there is a lot of bloat, a lot of inefficiency, a lot of waste. And with these sorts of plans, maybe with using public investment corporation funds for something like the NHI, it's not, you don't see the argument like you've mentioned in terms of returns on investment and actual enabling factors, because I don't see something like the NHI fixing the basics in public healthcare, like getting facilities up to scratch. You can have, maybe let's assume you tap the 2.7 trillion rand, all of it in the PIC. I don't think even that gets all these public healthcare facilities up to scratch to benefit those citizens ostensibly who it's supposed to help.
No, I think that's exactly it. You can throw all this money at the public healthcare system, and you're not going to fix it if you don't fix things like management, getting rid of corruption, and just the attitudes of staff and so on. I mean, you've heard horror stories in South Africa of where people go in a public hospital and the bedding hasn't been changed for like 3 months or whatever the case is. That's not something that money can fix. That's something there's got to be a change in attitude of the management and of the people who work in the hospital. And I think when it comes to things like fixed investment, that's also an important point. And that's the other thing when it comes down to it, is that we need economic growth. NHI is not going to work anyway, but it's not going to work without having much higher levels of economic growth. If we have economic growth of 5 or 6% or whatever the case is, that means that the government will also have more money to be able to put into infrastructure. It'll have more money from tax. It'll have, it'll be a kind of a virtuous circle. But also, if we have more economic growth, we'll see more people in work. More people will be able to afford private medical aid, and that'll take less. They'll take more pressure off government facilities and so on. And that's also something the government needs to look at. There's, as I've said before, nobody is against the idea of all South Africans being able to access decent level of healthcare, but NHI is simply not the way to get it. How you can do it is also making it easier for people to join medical aids, having low-cost medical aids, maybe forcing people who are in informal employment to be on a medical aid. And what you could do for people on lower incomes, the employers could subsidize them and then get a tax break for those subsidies of their employees on lower incomes or whatever the case is. There's just so many other ways to expand healthcare in South Africa, and NHI is simply not the way to do it. It's instead of expanding private healthcare to more people, we want to get rid of private healthcare and make more people go into the government system. And it's such a backwards way of looking at it, and it's going to destroy overall healthcare in South Africa. And yeah, it's simply not going to work. I mean, I think the only people who believe it's going to work are ideologues in the government and in the ANC and its related organizations.
And Marius, just a final question. In your press release on this particular issue, to which we will link in the description below, you mentioned prescribed assets. So this has been floated beforehand. Various ANC policy conferences is one of maybe the pillars for ANC policy priorities. Do you see this, the floating of this idea of encouraging or proscribing that the PIC should invest in something like the NHI as a form of prescribed assets?
I think you can definitely call it a form of prescribed assets, because a PIC will be, I mean, I don't know if they'd be forced to, but I mean, they're obviously part of the government. And the problem with prescribed assets is that they always get a much lower return than they would get otherwise. And that's exactly what's going to happen to these assets. Government employees' pensions aren't going to get the returns they should be getting. And it's also kind of the thin end of the wedge. If they start thinking, well, we've done it to government employees, why can't we do it to, people who've got private pensions? And we mustn't think this danger's over. This is something that the ANC keeps constantly talking about. And again, it just comes down to it. People's pension money is their after-tax money. It shouldn't be going to fund what the ANC thinks is a good idea. But that all said, as I said before, pension funds actually like investing in infrastructure projects because they projects with long horizons. At the end, you generally get a guaranteed return, or if it's done properly, you will get a guaranteed return, whatever the case is. So pension funds want to invest in infrastructure projects. The government's got to be able to provide those infrastructure projects that are run properly and that are managed properly and will give a return to pension funds at the end of the day. That's what needs to happen. Pension funds will be happy to put money into infrastructure projects, but they can't be forced to put money into infrastructure projects or healthcare, whatever the case is, if there's not going to be a return on it. This money is not a slush fund for the government to use. It belongs to people, whether they're government employees or private sector employees.
Yeah, the NHI and the implementation thereof will continue to be, I think, a great tension point within the GNU. Hopefully it can be navigated and dealt with. But for those individuals and parties within the GNU, I think, who are concerned about public sector employees who have worked in their roles and jobs for decades and who have tried to invest and save where possible, this would be deeply irresponsible for those politicians and bureaucrats who are the custodians of the PRC and should be managing those funds properly, to just use it on something like the NHI, which won't deliver, I think, in any particularly practical way, any positive results. But Marius, thanks once again to all of you. Thanks very much for watching, and we'll be back with you again very soon. Bye-bye.